Victoria's current restrictions. What is changing? From 19 November 2021, more restrictions were eased in Victoria, but it doesn't mean that COVID-19 is gone. Where to wear a mask? In retail settings such as Coles, Bunnings, JB Hi-Fi, etc. Primary school staff and visitors, and for students in years 3 to 6. Workers serving in public at hospitality venues, on public transport, and in rideshare vehicles. In high-risk work settings such as hospitals, nursing homes, corrections and meat, poultry and seafood processing will continue to wear a mask. Victorians must still check in everywhere, every time, no matter how long they are at the premises. Public and private gatherings will have no limits to the number of people who can attend. There will still be mask requirements, density limits, and caps in place of weddings, funerals, places of worship, and other settings if the vaccination status of attendees is not being checked. Non-essential retail settings such as cafes, restaurants, hairdressers, Kmart, etc. across Victoria will only allow Victorians who are fully vaccinated, under 12 years and 2 months, or have a valid exemption to enter the area. Dance floors and nightclubs can reopen to fully vaccinated, and standing at venues can return. If you have tested positive to COVID-19, make sure you are safe and supported. Help, money, and food are available for you and your family. You must quarantine at home for 10 days. The people you live with must quarantine with you for 7 days if fully vaccinated, and for 14 days if not fully vaccinated. Tell your social contacts, such as the friends you caught up with, that you had COVID-19 when you were together and recommend they get tested. You must tell your employer or school or higher education provider that you had tested positive. If your child has tested positive, you must notify their school, childcare, early childhood education center as soon as possible. If you are a close contact of someone who tested positive, household contacts, you must quarantine at home for 7 days if fully vaccinated, and for 14 days if not fully vaccinated. A household contact is someone who lives with a case or has spent more than 4 hours with them in a house, accommodation, or care facility. Social contacts. If you are a social contact of someone with COVID-19, you are strongly recommended to get a standard PCR test at a testing center and isolate until you get a negative result. Workplace or education contacts. You will be informed by your workplace or education facility. You are required to get a standard PCR test at testing center and stay isolate until you get a negative result, and show evidence of your test result before returning. You will also be offered rapid antigen tests for recommended use afterwards. Other contacts. The Department of Health may directly provide you special advice, including to get a PCR test or quarantine if you have attended some high-risk public venues where positive cases have been visited. You must follow that advice.